USMLE Step 1 Prep. Biochemistry-20. Which enzyme is responsible for the conversion of glucose 1-phosphate to glucose 6-phosphate? Phosphoglucomutase. Which enzyme degrades glycogen to glucose in the lysosome? Lysosomal acid maltase. -1 for glucosidase. Glycogen storage diseases involve an abnormal accumulation of toxic levels of what substance within cells? Glycogen. How many types of glycogen storage diseases are there? 12 glycogen metabolism enzyme deficiencies have been described in humans. A patient has severe fasting hypoglycemia, increased stores of glycogen in the liver, hepatomegaly, and elevated levels of lactate in his blood. What is the likely underlying metabolic deficiency? Von Gierk's disease, glycogen storage disease type I, resulting from glucose 6-phosphatase deficiency. What is the prognosis for a child diagnosed with Pompe disease? Early death. Name 4 glycogen storage diseases. Von Gierk's disease, type I, Pompe disease, type 2. Cory's disease, type 3, McArdle disease, type V. Very poor carbohydrate metabolism. How can you differentiate between a patient with Cory's disease and one with von Gierk's disease using blood samples? Patients with Cory's disease have normal blood lactate levels due to intact gluconeogenesis, whereas those with von Gierk's have elevated blood lactate. In a patient with McArdle's disease, would you expect increased or decreased levels of glycogen on muscle biopsy? Increased levels of glycogen, because the muscle cannot break it down. What disease is the result of a deficiency of lysosomal -1 for glucosidase? Pompe disease, glycogen storage disease type 2.